Can we please stop telling women to stop their hormone therapy because they've found a lump in their breast before we've had any kind of investigative work done, before there was a mammogram, before there's been a biopsy, before anything? These doctors are out there saying, oh no, stop all hormone therapy, because they are not hormone literate. A lump is not cancer. Telling a patient to stop HRT is not evidence-based medicine. It's jumping to conclusions, and we don't do that around here. When we use it properly, estradiol is preventative medicine. It reduces risk factors. So even telling patients to stop estradiol isn't warranted. Although, if you weren't properly trained, I can understand how you would say, oh my gosh, stop estrogens. And then, okay, maybe, but even at that, still not evidence-based. Stop prematurely telling women to discontinue their hormone therapy if you are not trained in hormone therapy. Telling women to stop their hormone therapy strips them of the very protection and prevention we are trying to preserve. It's a reflex, and this reflex to discontinue their HRT, it's not evidence-based. It is evidence of a lack of training. It is fear-based medicine, not evidence-based medicine. Women deserve providers that understand the nuance, and these ones aren't it. It's a fight within my own clinical practice. When women discover a lump and the first thing they do is go to their family doctor, who then says, oh my God, stop your hormone therapy. You do not have the training required to understand the nuance. You should be referring them back to the hormone specialist who's dealing with their care, because that's what we do day in and day out. We're going to advise that patient on if something should be stopped, titrated down, reduced, removed, or increased based on the scenario. There are many benign cancers out there. There are many other reasons why you could have a lump. You need to confirm pathology first. So that's first and foremost. And we're all going to be scared because what if we're feeding cancer? Stopping the hormone therapy is probably going to feed cancer if it's there, more so than continuing the hormone therapy. Not all cancers are hormone positive, although, 70% of them typically tend to be. You can have ER positive, you can have PR positive, you can have ER and PR positive breast cancers. That's an estrogen receptor positive and a progesterone receptor positive breast cancer. But that doesn't mean you should be stopping all hormones. If you have an estrogen receptor positive breast cancer, you can still take progesterone, and you should still be taking progesterone. Studies are actually showing that continuing with progesterone therapy, the natural progesterone, might actually balance out estrogen's proliferative effect. Progesterone acts as a regulator. That means it's apoptotic to breast cancer, which I've said in about 1 million different videos. Testosterone is also key. We use it in breast cancer treatments. It is protective, it is preventative, it is treatment. So you should not be stopping your testosterone. Real progesterone is not a growth factor in breast cancer cells. Progestins, you don't want to touch those. Progesterone, a natural, real, a bioidentical progesterone, the compound that is the same as our body's own progesterone, is not going to cause an issue. Even if you have progesterone receptor positive breast cancer, you don't need to stop taking it. This sounds crazy to some people who don't understand how progesterone works within the body or how progesterone receptor positive breast cancer works. It actually induces apoptosis. That is programmed cell death in abnormal breast cancer cells. And it's been shown to possibly reduce proliferation. This means that continuing to take your progesterone, even with a progesterone receptor positive breast cancer, is going to be beneficial. So telling a patient to stop taking these protective, preventative hormone therapies is going to make their outcomes worse if cancer ends up being what the biopsy shows to be present. If, because a lump or a bump does not guarantee that it's cancer. Please, if you are not hormone trained, stop telling women what to do with their hormones because you have no idea what you're doing. And please, if you are going through hormone therapy, if you are seeing someone who is hormone literate, please, please, please defer your care to them. If you find a lump, contact them. If you're being referred for a mammogram or a biopsy or an ultrasound, let your provider know, tag them in, and discuss your hormone therapy with them. They're the ones who prescribed it. Those are the ones who have the training, I would hope. Let them be the ones who decide with you as to what the best course of action is moving forward, if this is your scenario.